Good morning, Mr. van Trotsenburg. Thank you for joining us for this interview. The overall economic rebound in 2021 seems less important than expected. Are you aware of the reason of this outcome?
Yeah, well, there are some, you see that in some of the European countries, the recovery or the crisis is maybe a little bit less deep. Nevertheless, it is still the worst crisis in over the last 100 years. So I think it is always in relative terms. And we see also other continents still being affected by this terrible coronavirus. A case in point is Latin America, which is particularly hard hit. So I think we should not underestimate that still this is a very, very deep crisis. Clearly, if the recovery would be strong, that everybody would wish, but it will largely depend also how quickly we will find and have a vaccine available.
Mm-hmm. What is the situation by region? Which economies are most likely to absorb this shock, and what are the most affected countries, notably in the south?
Well, I think you need to differentiate between the short-term and the longer-term impacts. I mean, clearly, the region that is maybe in relative terms has had the least decline is Asia, although there are big differences between China and then ASEAN countries and India, where you are. Africa is also affected, but I think it has the recession is not so deep as in other countries. At the same time, this is the first recession for the African continent in 25 years. The region that is worst affected is Latin America, with a very deep declines, and that is from Mexico to Argentina. And you see there sometimes double-digit decline. So it is serious. And we should also not underestimate the impact this crisis is having on the small states, small island states in the Caribbean or in the Pacific. And there you see actually not only the coronavirus hitting, but also because of tourism, completely being dead, that this economy have a double hit. On top of that, they rely a lot on remittances. So there you see very, very steep contractions happening.
What is the situation in the countries dependent of raw materials? Is there a direct impact of this crisis?
Well, I think you see with particularly commodity exporters, and the most prominent are those who are petroleum exporting countries, that you see there a deep crisis because petroleum prices have fallen very, very steeply, and that has affected their overall economic prospects. Also with the other commodities, clearly with demand much softer, this has had negative consequences for farmers in these countries. So this is why we are coming always back to the important thing is this corona crisis has a clearly health-related effect, but it is having ripple effects into the economy. It is affecting employment and longer-term growth. For that reason, the World Bank, when we released our poverty report, pointed out that in the first time since over 20 years, the extreme poverty numbers are going to increase instead of decline. We have seen over the last decade. Sorry?
How many new poor people due to the health and economic crisis? I think it's 150 million.
We have the estimates for this year between 88 and 115 million. And then if the situation were not to improve, this number could increase to about 150 million people next year. I'm talking here about the extreme poor. then there are also that are people living below $1.90 a day. But of course, there are also a lot of poorer people that have to survive on less than $3, and there also the numbers are increasing.
There were some meetings of the G20 this year. There were some measures to suspend the debt interest. What are the effects of all these measures right now?
Well, that was very important. What we and the World Bank always are saying, during times of crisis, we need to act fast, decisively, and at scale. And that is what we have been doing. We announced a package that we would like to implement over a 15-month period, namely about $160 billion to the poorest countries. However, these funds can only be effective if they are applied in the countries themselves and are not being used to pay debt service to other creditors. And so we called already in March for the suspension of official debt service to official creditors. This became the debt service suspension initiative, and this is providing important also relief. What we are now saying for the annual meetings that are taking place right now, that we would like to see that extended, and we are very optimistic that it will be extended. We wanted to have it as long as possible, namely a year. Probably it will be a half a year extension with a possibility of another half a year extension. But these are important resources these countries need during times of crisis. These are the resources mainly for the poorest countries.
But should we tackle also the debt stock, or not simply the interest? I think there were a lot of...
No, this is the debt service, but you are completely right. This is just a short-term measure, and the World Bank has been emphasizing that this is a good measure, but not a sufficient measure. We will need also to look at the debt sustainability of countries, because some countries have structural problems with their debt, and that will need to be addressed, and including potentially debt stock reduction.
Okay. Do you explore new mechanisms? We can mention maybe a de-risking system of guarantee for the private sector.
Yeah, this is very important, particularly for the poorest countries. What we have done in the Fund for the Poorest, there we have a fund for about $82 billion over a 3-year period. What we did a couple of years ago is precisely saying, look, these investment in the poor countries, if you are wanting to invest in the Sahel zone or in the Central African Republic, many investors will not go there because of too high of a risk. So therefore, we have created a $2.5 billion facility that's called the private sector window, that helps the private sector to de-risk investments in the most difficult countries. And that is it needs to be done, because otherwise these investments are not taking place. So this is one area where clearly we are pushing, and what we think is actually there are more resources needed for de-risking, because indeed while private sector actors would like to be in these countries, it's also clear they don't want to lose all their money. So they need to have some a security or a de-risking device that we are offering. We hope that other institutions would do the same.
What is the level of the debt in the South countries impacted by this crisis? Does it increase a lot?
I think it depends. Here you have to see between countries that are commodity exporters and non-commodity exporters. We are seeing there particularly the double effect of, for example, in oil exporting countries. There you see often substantial increases of the debt. And you see the debt to GDP ratios increasing, and sometimes by 10, 20 percentage points in 1 year. So that is very high, and that will need to be addressed.
Okay. A big part of the South debt now is detained by China. Do you have discussion with Beijing to participate to this exercise of debt effort?
Yes, we have discussions with them. Also, these discussions are taking also place with the Paris Club creditors. It is absolutely necessary when there is debt relief that all creditors participate, and that includes also official creditors and commercial creditors in China or elsewhere. What is going to be a key for the success is that there is equitable and fair burden sharing when a debt relief is granted. And that is the reason why we are in touch also with the Chinese authorities, but also with other countries to make sure that everybody is participating.
The health crisis is expected to last. We are talking about the second wave right now. How to help the countries of the South to strengthen their health system and acquire this famous vaccine?
This is a core topic for the World Bank. We have always said that it is important to look at health system strengthening. It's sometimes not so popular by agency because it's not so visible, but it is ultimately the key to success. Think about the vaccines. How do you deploy and deliver them? Very often you need cold chain technologies, and if you don't have refrigerators or the infrastructure in the hospitals, you cannot deliver these vaccines. So what we have said is we have announced that we would like to help finance these vaccines and provide make available to countries about $12 billion, but also we would like to work with the countries on establishing this necessary infrastructure, because without good infrastructure, you will not be able to deliver the vaccine. So it is absolutely essential.
Are these countries more resilient? I talk specifically for Africa because they have in the past to deal with disease like Ebola, HIV.
I would be careful about that. It is, as you know, that the health systems still in the low-income countries are weak. So I would not say that they are resilient. I think there is a lot to be done. And I think we should not take this lightly. I think we should actually see how we can double our efforts to improve the health systems in Africa and in other low-income countries. This crisis is only a reminder to do more.
This crisis is also dramatic for the loss of human capital. More than 1.6 billion of children have been out of school. Is there any solution like e-education on other system to promote, to replace, and to help in this current situation?
Well, I think this is something we are pointing out. This is dramatic when you have 1.6 billion kids out of school, and particularly in the poorer countries, this may mean that some of these kids will stay permanently out of school. I'm thinking particularly of girls. And so we need to see how we can get back them into school. Of course, among the developing countries, there are many differences. Some are middle income countries where in the cities kids have access to internet, so you could have more e-education programs. So that would be one way. But in many countries, those infrastructures are missing. So one will need to see how one actually allows as soon as the situation allows this, to get kids back into school in order to make up for the lost time. But I think this is certainly something one will need to have a discussion about. What are the strategies to recover this lost time? Because when kids are less long in school, this will ultimately affect their earning capacity during their life. And what we have been estimating is if these things are not recovered, then the earning power of a whole generation will be less. And so this will have to be a point of focus as soon as this crisis is also over.
Last question. Big Pharma are in the way to find this vaccine. How many time, in your opinion, will be necessary to recover the level of growth or the level of GDP the countries have before the crisis?
I think I would not speculate too much, but what you are looking at some of these crises in the past, that there are huge risks that takes years to recover. You saw that in Latin America after the debt crisis, there was a lost decade. You see it with the financial crisis 11 years ago. Many countries, even in industrialized countries, took a long time to recover their per capita incomes pre-crisis. So it will be on the speed with which we will have a vaccine, and also the speed with which this vaccine can be then distributed globally. And then it will depend on how quickly industry. It's a fair assumption that will take years to recover, since many people will be very hesitant to immediately travel as they did pre-COVID. So our concern is clearly that this is a longer term affair. What we need to do is to see how we can provide incentives towards a quick recovery, so that period between the end of the crisis and the full recovery is the shortest possible time period.
Thank you very much, Mr. van Trotsenburg.
Pleasure. Thanks so much.